within normal. Still, whatever oxygen you are giving, he's going and back. يعني saturation is improving then decreasing, improving then decreasing. الفكرة إنه you should be able to use the regular airways tubes. If you are not, if you have a difficulty like patient with facial injury, with facial fractures, so you should be able to use the surgical airway. Once you are not able to do all these things, you can go to the last thing, which is the endotracheal intubation. Can someone tell me what is the surgical ways of to develop to establish an airway for a patient?
Talking to the patient.
No.
Tracheostomy.
Excellent. This is what طبعا الtracheostomy. This is the tube that you will put. What's the procedure itself? شباب ما هي محاضرة اني انا اتكلم طول الوقت. I need someone.
دكتور لو تكرمت بس ما فهمت السؤال زين.
What are the surgical ways to establish an airway for a traumatized patient?
We will make tracheostomy, an incision below the trochoid cartilage to enter the trachea.
I
Chest
want to
tube.
know what's لا. No, chest tube is not a way to establish an airway. This is to improve the ventilation. شباب يعني لما نقول حاجة نعرف شيء، بس مو نقولها بس. اللي يقول لي chest tube معناه انه ما يدري it's for ventilation not for airway.
دكتور التشست تيوب ما يستعمل بعد الديكمبريشن في حالات النيوموثراكس تو ريليف يعني التنشن اللي صاير.
This is for ventilation. Pneumothorax where it's happened in the chest. Once you put the chest tube, the patient's ventilation should improve. The chest tube is put for lung injury. إذا أنت عندك الأيروي already closed وتركب chest tube، حتى لو ركبت chest tube it will not improve. يلا شباب. طيب tracheostomy أنا I know tracheostomy. أنا this is إيش اسم البروسيجر؟ كريكو إيش؟ شباب ما يصير. كريكوثايرويدومي. شو الكريكوثايرويدومي؟ It is a way that you establish an airway through opening the cricothyroid membrane. انت الحين عندك الفيشيال fractured, البونز, الفيشيال anatomy is affected, so you are using an alternative way. You are opening cricothyroid membrane, the membrane between the cricoid and thyroid ligament. سيف يروح ويجي على التريك. يا سيف التريك it is the tube that you are putting، لكن البروسيجر itself يعني لما اسوي كريكوثيرابي ما راح اخليها مفتوحه كذا. I will put a tube. هذا التيوب اسمه التريكيستومي، لكن الفكره itself tracheostomy you can do it either as an elective or as an emergency. لكن in traumatized patient I need to do for the patient as a trauma اللي بيقرا بعدين trauma protocol. There is a surgical way to establish an airway which is called cricothyroidotomy. Okay. طبعا this is كأنها طريق مختصر. Instead of going through the mouth you are going through the neck to establish an airway. طيب. This is a way of establishing an airway during the assessment of during a assessment. طبعا during a assessment also it is very important that you will deliver the proper amount of oxygen to the patient. What do I mean? يعني the patient, once you are giving him oxygen, either you can put a nasal cannula, you can put face mask, you can intubate him. The most important thing that these patients, most of them, because of the pain, they will have difficulty. Yes, no, wait. They have a difficulty to uh, get oxygen, either due to pain or sometimes due to change of the level of consciousness. The most important thing that to help them to reach or to get the proper amount of oxygen so that they were able to get oxygen. طيب في اللي بيقرا بعدين في شيء اسمه head tilt وchin lift. This is something that should be done in a patient to establish an airway. الفكرة إنه الموست once يعني once you feel the patient he's unable to take proper breath, so there is something called head tilt or chin lift. This is a way to open the airway so that the patient can get oxygen easily. طبعا الفكرة إنه sometimes even with these things the patient will not be able to take breath, so you can apply something called orotracheal tube. It's a tube that put through the oral cavity to guide the oxygen or to make the airway open so the patient can easily get oxygen due to the chest. The most important thing that when you are assessing this patient and you are trying to open the airway, and you should ensure that he's not having any spinal injury, cervical spinal injury. Cervical spinal injury will impact your way to open the airway. يعني مهم جدا انك تتاكد انه he doesn't have any cervical injury, لانه any cervical injury with movement or mobilization with the head tilt and the chin lift or the jaw thrust, the patient condition or the patient fracture or the patient injury will be worse. Next step, once you ensure that your airway is clean and the patient can open his mouth and you are sure that oxygen is delivered properly, is the assessment of the breathing. Breathing is, you will assess the breathing, you will check the patient, you will check his by inspection you will see if there is any bruises, if there is any fractures, if there is any foreign body, if there is any change in the movement of the chest, bilateral movement or unilateral movement. The patient is having any swelling that will affect the breathing process itself, and you will attach the pulse oximetry. You will ensure that you already delivered the proper oxygen by checking the airway properly. Once you are assessing the patient and you find that there is an abnormality, you should manage this abnormality. Like if the patient is having unilateral movement of the chest, that means the other side mostly it's affected either due to a pneumothorax, due to hemothorax, due to flail chest. So you should assess the side which is affected bilaterally and then concentrate on the side that you think that it is mostly will be affected due to the trauma. If the patient is having pneumothorax, طبعا شباب النيوموثوركس كنتم ما ادري محاضرة التشست ما دخلت معكم الترم هذا لكنها كانت في المنهج القديم. chest trauma, once you get patient with a pneumothorax, شباب الانواع النيوموثوركس في simple، في tension، في open pneumothorax. simple pneumothorax usually the patient vitals will not be affected. tension pneumothorax كويس خدتوها ممتاز. tension pneumothorax the patient there will be affection of his vital signs. Usually the patient will be hypotensive. Open pneumothorax, there is an opening which is air being sucked inside the chest and being trapped. So during your assessment, if you think that your patient is becoming hypotensive and there is unilateral movement, and upon the assessment of the chest inspection, auscultation, these patients they have a pneumothorax, so a rapid intervention should be done to relieve this tension. طبعا two ways to solve it. What are the two ways؟ طبعا في fast way وفي the traditional way. The fast way is applying a needle in the chest at the site of the second midclavicular space. It is something which is temporary. The needle should be with a high bore needle. No فيصل حرب فيصل اصبر. انا قلت لو تركز معي فيصل قلت there is a fast way and there is a traditional way. Fast way usually it's done by the pre-medical people in the pre-hospital course. A needle in the second intercostal space at the midclavicular line. It's a needle that will decompress the pneumothorax for 45 minutes. Then the patient after that should go for the traditional chest tube insertion. التراديشنال لو تذكرون دائما في الأسئلة الديفينيتيف مانجمنت is chest tube insertion. In this way you'll be able to relieve the tension, you'll be able to remove all the trapped gas in the chest, and after that you can observe the patient and you can see that there will be improvement of his saturation, improvement of his blood pressure, either tachypnea, chest pain. أبغى أحد يقول لي how can we differentiate أو how can مدام المحاضرة شرحت when we are putting the chest tube, what's the difference in putting the chest tube between the hemothorax and the pneumothorax?
احنا اللي نعرفه دكتور ولا النيموثوركس انه يكون anterior to the mid-axillary line at the fifth intercostal space.
No, Faisal. English, please, Faisal. No, not like this. When you are guiding the chest tube and the hemothorax and pneumothorax, what's the difference?
ما وصلنا للليفل هذا يا دكتور. اللي عرفناه بس main differences between الهيموثوراكس والهيموثوراكس بالنسبة للأسكلتيشن، بالنسبة للنيك فينز وما إلى ذلك يعني.
مين اللي شرحها المحاضرة؟
كان الدكتور.
أيوة. So the differences is that air pneumothorax air usually air when air usually it will be up higher. This is pneumothorax. In pneumothorax usually the blood will be down. الفكرة إنه الجرافيتي is affecting this thing. يعني لما أدخل الجست tube I should ensure that the tube is going up and then in the lung. لما I put this is for the pneumothorax. For the hemothorax I should ensure that the tube is going down little bit. tip. فهمتوا الفكرة يا شباب؟ عشان to make it relieve it. واضح ولا مو واضح شباب؟
يعني يختلف مكان التست تيوب في الحالتين.
لا الفكرة مو بمكانه. all will be in the chest cavity لكن guiding it go up in the pneumothorax. In the hemothorax الهيمو يعني مو داون توصلها للليفر لكن you should guide it in a way that blood by gravity يا شباب.
accumulated blood.
صح يعني انتوا لو تحسبونها فيزياء يعني الاير دائما وين يحب لانه خفيف راح يطلع فوق. طبعا يجيني واحد يقول لي دكتور ندخل الحين في تفاصيل يعني الدكتور لو كان بيج نيوموثوركس لو كان بيج نيوثوركس راح يملي اللنج كامله من فوقها الى راسها من اولها الى اخرها. لكن الفكره انه ركبت انه مثلا تشست تيوب وكان عنده هيموثوركس وانت you notice that after 6 hours it is not working. Well, patient still he's having some tachypnea, his saturation is not improving. انت should خلاص يعني هذه الفكرة. This is يعني حاجة more practice انه I should know why it's not working. Is the tip in the proper place? Is the tube kinked? There is any leakage? There is. فهمت قصدي؟ هذا قصدي انا لما اتكلم عن الchest tube. It is not only putting tube and enough. You should guide it in a way that it should work. And the most important thing, once you put a chest tube, you should ensure that the chest tube is in place and confirmed by chest X-ray. Once it's confirmed by chest X-ray, then you'll see improvement of the patient. If he is not improvement, اللي بيقرا بعدين اي كتاب اللي بيقرا شوارتز, once the patient chest tube is not improving, you can put another chest tube in the same side. To put two chest tube in the same side. طيب patient is not improving. Patient is not improving معناه these patients usually they are having a tracheobronchial injury. للي بيقرا tracheobronchial injury طبعا ده حاجة شوي advanced شوي. Tracheobronchial injury معناه these patients they will have pneumothorax all the time whatever chest tube you are putting. طبعا usually they are diagnosed by admission in the ICU. يعملوا لهم حاجة اسمها bronchoscopy to find where is the injury exactly. Then it can be sutured and repaired. أي subcutaneous emphysema, لكن subcutaneous emphysema once there is leak of the air. لكن أنا ما أركز على subcutaneous emphysema وأنسى المين issue. طبعا subcutaneous emphysema it's leak of the air in the subcutaneous tissue. لكن leaking هذا once it is large big amount of leaking, you should find where is the cause. أنا مو بس أركز على subcutaneous emphysema وأنسى الكوز. What's the cause? Is the cause due to an injury or there is a cause due to accumulation? نرجع مرة ثانية للبي الهيمو. نفس الفكرة الهيمو والنيوموثوركس. طبعا في الهيموثوركس يا شباب I have some guidance in doing any intervention of the patient. إيش معنى؟ Once if I drained by the chest tube 200 or I drained 1000, هنا يجي يا شباب حاجة للي بيقرأ بعدين شيء اسمه thoracotomy. Thoracotomy يا شباب it's a surgical way so that you open the chest cavity and try to find what is the bleeding in the chest. طبعا الissue إنه these things usually done for a patient who is actively bleeding in the chest, and it is done for a patient with a large amount bleeding. يعني إيش معناها؟ يعني patient جاني trauma. I got a patient with a trauma and I found that during examination that I'm suspecting he's having a hemothorax and this patient is unstable. So I initiated the chest tube insertion and I noticed that there is more than 1500 cc of blood coming once مرة واحدة. That's mean إيش معنى 1500؟ كم كيس دم؟
كيس الدم 450 على ما اعتقد.
صحيح فيصل. So 1500 كم كيس دم؟
3 أكياس تقريبا ونص أو 3 أكياس. 5 أكياس.
يعني شوف كيف it's a very large huge amount. معناه البيشنت هذا is actively bleeding. So in this way I will do something called thoracotomy. يسمونه ER thoracotomy. طبعا اللي بيقرأ كتاب survival rate of these things usually very low. يعني أنا المرضى اللي شفتهم was done for them most of them died. لأنه الفكرة إنه these patients they reached a level. لو تذكرون عن الشوك he lost more than 1500. يعني he is in shock grade 3 ومعها يعني ودخل في الفور. So usually this patient survival rate is very low, and either also finding the bleeder and controlling it is very difficult, and they will need to be admitted in the ICU. طبعا after losing like 1500 cc of blood, usually there will be multi organ infection. يعني بس اللي بيقرا بعدين عن كيس الثوركتومي يعرف انه why the thoracotomy is applied. طبعا جاني واحد قال طيب يا دكتور، لو واحد قرا what if the patient did not get a large amount، يعني in the first hour when I applied the chest tube it's bringing like 200 250 300. هنا يجي the most important thing to observe how much is coming out per hour. If it's during 4 hours bringing more than each hour more than 250، معناها 250 في 4 معناها more than 1000. يعني these patients usually they have an active bleed, especially if it's a fresh blood. This is one of the indication you can do for him thoracotomy. طبعا في indications كثيرة اللي بيقرأ، لكن usually these the most things which are being applied for this patient. طبعا left lateral thoracotomy, once you will be able to enter the chest cavity, try to find what is the bleeding. يعني sometimes it can come from the lung itself, lung parenchyma. Sometimes it is coming from the intercostal vessels. Sometimes it's coming from inside big vessels injury. فالفكرة انه عشان كذا السرفايفل ريت حقه very low. طبعا one of the things that you should consider in a patient coming to you with breathing problems is that you should ensure that he is not having any cardiac tamponade. Usually cardiac tamponade, مشكلة cardiac tamponade that you are the airway is good لكن the patient is hypotensive all the time. You are giving him IV fluid, he is improving partially, but still his blood pressure is going down. You are doing for him مثلا fast في الابدومين fast negative، لكن whatever there is no other source of bleeding. فهنا يجي الفكرة انه very important not to forget these things، لانه these patients once you suspect that they're having pericardial tamponade, treatment is easy. It's only removing the blood or the clot from the pericardium. طبعا being able to use the fast properly will make it easier for you. البريكارديك tamponade المشكلة انه small amount of acute accumulation اللي بيقرا بعدين في الميديسن. Small amount acute accumulation of blood, the pericardium will affect the cardiac contraction. So these patients usually they will be hypotensive, there will be muffled heart sound. الفكرة انه المفل heart sound هذه حط في بالك انه usually these patients once they reach a level that they are having a cardiac injury, usually it's associated with chest or lung injury. excellent فيصل. obstructive shock. طبعا ما بيتكلم بالشوك لانه الشوك موضوع ثاني، لكن it is one of the types of obstructive shock. Relieving the pericardial tamponade will improve the patient vitals، لكن not يعني اللي بيقرا بعدين في اي كتاب في احيانا اشياء one of the things that patient will not improve يعني في الكاردياك tamponade if he is not improving you maybe can take him and do thoracotomy and open the pericardium. طبعا يعني هذه فيلم طويل، لكن الفكرة انه going to the heart where is the bleeding exactly and control it. طبعا كل هذه الاشياء زي ما قلنا it's something that usually the prognosis or the outcome for these patients is not good. After that, we will go to the circulation. Circulation, as we said before, assessing any signs of external or internal bleeding, any upper or lower limb bleeding or hematomas, doing for this patient fast, طبعا examination of the abdomen, inspection, palpation, percussion, auscultation, and assessing fast in the 4 areas that I said before. الفكرة إنه usually in any patient with suspicion abdominal injury or assessment of the C circulation, your main guidance is the patient blood pressure, patient pulse. You are supposed, if the patient is having any signs of active bleeding, once you give him the proper IV fluid, his vitals, his blood pressure, his pulse will improve. There is no improvement either even after giving the IV fluid and giving this patient the proper painkillers. You should search for the cause. طبعا الفكرة إنه the abdominal cavity with the pelvic cavity they can يعني hold till a bleeding till like 2 liters of blood can be seen in the pelvic cavity. 2 liters يعني شيء كبير. So the most important sites of bleeding usually in retroperitoneal vessels, if there is any hilar injury of the liver and the pancreas, if there is any mesenteric injury to the root of the mesentery with active bleeding. طبعا this is the areas usually that the patient will have. طبعا bleeding ممكن يكون في أي مكان، لكن this is the areas usually which the bleeding once it get injured, the bleeding will be profuse in these areas. Fast should guide you, and fast should relieve you from any stress if you think that the patient is having any active bleeding. طبعا all these things should guide you to the patient stability, A, B, C. Once you think that A, B, and C is fine and there is no other things that you suspect, very important to check the patient neurological system by assessing the disability D. By assessing D، الفكرة يا شباب إنه دي انحطت مع البرايمري سيرفي لأنه usually injury will affect all of these. Any neurological injury will affect the airway. Any neurological injury will affect the breathing. The effect will affect the circulation by affecting sympathetic or parasympathetic way. Once you suspect that there is a patient with neurological or disability, you should do for the patient the Glasgow Coma Scale. You should check if the patient is having no spinal injury, there is no signs of lateralization like pupillary reactions, level of consciousness. So once you check it and you are sure that the patient is not having any signs of lateralization and his Glasgow Coma Scale is within normal, you can go and expose the patient and try to control his hypothermia, try to warm the patient. And after this primary survey, don't forget to شباب آخر حاجة قبل لا أروح للسكندري سيرفي.
Environmental factors, triad of death. We cover the patient from hypothermia and check the coagulopathy and the acidosis.
Excellent. لكن في حاجة ثانية.
Motor response.
No. شيء اسمه log rolling in the patient. Log rolling, what does it mean log rolling? You should examine the patient back, assess the anal tone. ما قد ما سمعت كلمة هذه اللوج رولينج.
لا هذه أول مرة.
لوج رولينج LOG أو LLING. رولينج يعني بالعربي تلف البيشنت along his lateral side left or right، غالبا left side، to assess the back. patient ما تدري يمكن عنده he is having spinal injury and you don't know about it، صح ولا لا؟ This is one of the primary survey. تخيل مريض يكون عنده fracture lumbar fracture ولا patient he cannot move his lower limb وانت you don't know. فهمت الفكرة يا شباب؟ انه log rolling of the patient. This is one of the things that we were asking last year about it and no one knows about it. It is a way to assess the back of the patient, to assess for any cervical tenderness, for any injuries, or for any foreign body. Sometimes you will examine, you will see foreign body. تلقى part of the trauma، حديدة داخلة في ظهر وانت ما تدري.
دكتور طيب كيف أسوي assessment للانال تون والمريض أصلا unconscious؟
if the patient is unconscious هذا شيء ثاني يا فيصل. If it is unconscious، لكن once the patient is conscious you should assess it. There is any bleeding.
دكتور عشان هو السفير سباينال انجري ولا لا؟ الانال تون
كيف؟
الحين نسوي اسسمنت للانال تون عشان نشوف اذا كان في سباينال انجري ولا لا.
Yes. Assessment of the anal tone, if there is any bleeding, if there is a foreign body, anything that you should search for it. يعني الفكرة هذا تروما يا شباب، انت تروما ما تدري وش صار في التروما، فلازم يكون عندك سكيم ماشي عليه. ممتاز. لو تلاحظ انا قلت log rolling of the patient، كويس معاذ، سؤال جميل. اتمنى يعني اذا جلسنا بعد شوي نفتح في اليوتيوب ونشوف how it's done in log rolling. It is not only one person job. You will call the nurses, you will call sometimes the medical back team. They will help you to remove the patient in a way that a homogeneous, stable, safe way to move the patient. يعني بكتب لكم هنا عشان بس لازم نعرف الكونسبت هذا. Once you assess the back and you log roll the patient and there is no injury, now you should start ordering your adjuncts اللي تكلمنا عنه المرة الماضية. أنا ما أبغى تقول شيء تكلمنا فيه قبل لأنه إعادة بيكون، لكن الفكرة إنه these things the adjuncts should guide you to either to proceed to the secondary survey or repeat the primary survey. شباب, primary survey is the survey that either you will save the patient or not. Once there is a primary survey, there is a pathology that you did not discover it. Usually this pathology will affect the patient life. طبعا secondary survey, it's from head to toe. Usually this is for the non-lethal injuries which is may harm the patient in acute way. طبعا one of the things that you should put in your mind that when you are doing your secondary survey, it is assessing if there is, especially the upper part of the body, assessing the patient if he is having any signs of base of skull injury. What does it mean, base of the skull injury? Usually the patient will be having either otorrhea or rhinorrhea. What does it mean? It is leakage of the cerebrospinal fluid through either the mouth or either the nose or either the ear. Usually once you think that this patient having this leak, معناها this patient they are having base of a skull injury. Base of skull injury يعني هذه حاجة ثانية. excellent. Panda eyes, yes, excellent. ممتاز فيصل. battle sign, excellent فيصل. These signs usually they will predict that the patient is having an injury, and معناها this patient, his level of consciousness should be monitored properly. His Glasgow GCS should be assessed every like 12 hours to for 24 hours for any changes. CT brain should be done, and sometimes it can be repeated later. الفكرة إنه for after any deterioration، الفكرة إنه there are some things that usually they are not lethal يعني within a short time. لكن these things usually once you did not improve it, patient condition will be worse. يعني one of the scenarios, patient the trauma and the patient صح فيصل. لكن all these things usually once you discover it you should act according to it. لكن cranial nerves injury usually ما يجي cranial nerve injury alone، يعني يجي cranial nerve injury as a part of head injury أو as a part of facial injury. once you discover this or once you suspect, the full assessment of the neurological system from A to Z should be done. طبعا these things عشان ما أدخل في تفاصيل which is not my specialty, done by the neurosurgery people, and they have their own investigation. ممكن they will ask for CT or sometimes they can ask for MRI for more confirmation. لكن الفكرة إنه once you suspect a neurological injury it should be act and documented. لأنه مشكلة as we know that with a neurological injury if there is no intervention usually the affected part will end by atrophy, so it's better to be discovered. طبعا مهم جدا when we finish the secondary survey, once you think that the patient condition is stabilized, you should decide what's your plan for this patient. So my plan for this patient, I will admit him. I will summarize the patient condition. A patient young with no medical problem. He underwent a motor vehicle accident in the morning. Patient, the history of the patient that he was a driver. He was hit by the side. He was wearing the seat belt. There was no ejection from the car. The patient during the motor vehicle accident was fully conscious with a normal Glasgow coma scale. Upon the assessment, upon patient reached the hospital, he was vitally stable. Upon the primary survey, his airway was intact and talking properly. He was having difficulty of breathing with tachypnea, and upon examination, he was found that he's having right side pneumothorax due to hyperresonant palpation and decreased air entry in the right side. So just a tube was inserted for him. بيجيني واحد يقول لي طيب يا دكتور ليش ما سويت اكس راي بعدين سويت له just a tube. This is according to the patient stability. If by clinical assessment patient stable, you can confirm by doing the x-ray. If the patient is not stable, you are allowed to put just a tube. Then after that, when the circulation assessment, there was no signs of external bleeding, and the patient was his pulse was within normal. There was no disability. His Glasgow coma scale was within normal, and بس my secondary survey يعني على حسب اللي تلقى فيه، لكن الفكرة my plan. So I will admit this patient either to the ward or to the ICU. I will keep him NBO. I will cover him with the proper IV fluid. Usually these patients they were supposed to be given a bolus of IV fluid, either normal saline or ringer lactate. And then after that, once you give IV fluid, you should ensure that the adjuncts is working properly. He's bringing out a proper amount of urine. If the patient is having any signs of penetrating injury, I will cover with antibiotic. I will give him proper painkiller. I will order blood labs for him, CBC, chemistry, coagulation profile. I will ask for blood grouping and cross matching, and I will make packed RBCs ready standby for him, either O negative or according to his blood group. I will observe his vitals Q1 hour or Q2 hours. I will admit him in the مثلا if he's going to the ward. I will reassess him after 6 hours, to be assessed after 6 hours, and according to the mood of injury or the suspicion of his organ involved in the injury. And then after that you'll see later. طبعا once a patient is having في شيء اسمه شباب uni organ, or if there is only one organ involved in the injury or there is multiple organs involved in the injury. يعني patient coming with the head and abdominal injury, or patient coming with the chest and abdominal injury, or lower limb. طبعا لا ننسى يا شباب during our assessment is the musculoskeletal assessment. Usually there is any signs of fracture or any signs of active bleeding, it should be controlled. طبعا مهم جدا assessment of the circulation, the peripherally, perfusion, all these things usually which is related to the musculoskeletal. If the patient is having any fractures, it should be fixed, splinted, and then after that the pulses which is related to this area, it should be assessed. يعني patient coming with knee fracture, so knee fracture usually associated popliteal artery injury, so assessment of the popliteal artery and the distal pulse is very important. Then after that, once the patient is inside, you will assess his response to your treatment. Then after that you can act accordingly. أي سؤال، أي حاجة، في شيء في الدسكشن ما هو واضح؟
شكرا.
شباب ناصر الشميمري.
سم.
What are the indication for thoracotomy in patient with chest injury?
عيد سؤال الدكتور معليش ما سمعتك.
What are the indication of thoracotomy in patient with chest injury? أعطني اثنين.
تراكيتومي يعني
thoracotomy.
ثوراكوتومي، نيوموثوراكس، تنشن نيوموثوراكس بعد.
كل مريض تنشن نيوموثوركس بس ثوراكوتومي.
ثوراكوتومي دكتور مو زي شست تيوب؟
نو، واضح انك يا ناصر ما كنت معي. ثوراكوتومي يعني شرحناها بالتفاصيل.
طب ترك برونكيال انجري
غيره. يعطيك العافية يا ناصر، واضح انك انت مركز معي.
احسبك تقول غير يعني واحد ثاني دكتور تبي يعني صح. طيب ترك برونكيال انجري
لا تسألني يا فيصل يا ناصر.
طيب.
انا عبد الله عياف. عبد الله عياف. patient came to the ER and you don't know what type of blood grouping he is having. What type of blood you will give him? What patient came to the ER and you don't know his blood group? What type or what blood group you will give him to save his life? ما تدري تسألني ولا تجاوب؟ ما اسمعك. And you will why you don't go give O negative O positive. قال لك البلد بانك يا عبد الله ما في عندي الا O positive والمريضة فيميل. You will give or not? البلد بانك ما عندي الا هذا. You will give or not? طيب لكن قلت as a beginning يعني أنا المهم عندي إنك جاوبت. أوكي طيب مين يبغى يجاوب؟ يعطيك العافية عبد الله، شكرا.
ممكن دكتور أعوض كريستالويد كان نقص بسيط. كريستالويد ممكن نعوضه فيه إذا كان نقص بسيط.
لا ما في. الكوليسترول عبارة عن اي فلويد العادي، واللي كاتب لي كولويد هذا سيف. ليش كولويد؟ يعني مريضة عندها اكتف بليدنج هيموجلوبين حقها 4، راح اقول له والله بعطيك بروتينز البيومين عشان اعدل لك الهيموجلوبين.
دكتور في حاجة توضع مع الدم تشيل العامل الرئيسي الRH. طيب
أبا أخش في a patient female if it's her first time exposure to blood transfusion you can give لأنه already there is no formed antibody against it. if it طبعا هذه الأشياء أنت ما تعرف، ممكن المريضة تقول قبل أنا أخذت ما تدري جاية تروما، أنت ما تدري الباك جراوند حقتها did she receive before or not. لكن once you give you should observe the patient status. يعني sometimes there will be a cross reaction. This patient may have already formed foreign antibodies to these O positive packed RBCs. So هنا يجي عشان كذا نقول لك once you give something you should reassess the patient. I gave her blood and I noticed that she started to become febrile. She tachycardic. Her color of urine has changed. معناها this patient is having a reaction to the already formed antibodies that she has from a previous exposure. عشان كذا دائما studies تقول try to avoid O positive especially for childbearing age females. لأنه if she is having any foreign body against it, any transfusion transfused blood will be fractured, it will be lysed, it will be lost. يعني المريض ممكن يدخل في complication of transfusion reaction أكثر من getting benefit from it. السؤال؟
نعم واضح دكتور.
طيب يا رشيد، رشيد اسمع صوتك يا رشيد.
الو دكتور.
طيب طيب انت رشيد صح؟ عشان اسمع صوتك زين.
اي نعم، بس المايك ما اشتغل.
اي خليك معي بس. فيه معاذ سائل سؤال حلو. دكتور طيب وش نعطي المريض اذا ما عندنا او نيجاتيف؟ حلو، كلام جميل مره يا معاذ. ترى هذا اللي يصير دائما. الفكره ان البيشنت يجي عنده بلد لوس، هنا يجي حاجه يجي على حسب السنتر. هذا سؤال يعني فيه كلام كبير. يعني مثلا بيشنت جاي تروما والبلد بريشر low ويو suspect injury. In these patients his hemoglobin is low. ما عندي blood او نيجاتيف، ما عندي اي من انواع البلد. طب ايش اسوي؟ طبعا هنا يجي ترتيب طبي اداري. يعني معاد السؤال هذا يعني فيه كذا، فيه اشياء متشابكه مع بعض. انه first if it's a trauma center usually they have their own blood bank and they have their own storage, they have their own protocols. في بروتوكول معين خصوصا مثل دائما في الحرس او المستشفيات هذه انه they have their own protocol. يعني بلد يكون في البلد بانك ما حد يقدر يطلبه الا للتروما بيشنت. طيب لو كان البيشنت جاي في التروما في بريفري سنتر، يعني مستشفى طرفي، هنا يجي لما كنت اتكلم عن البري هوسبيتال كورس. It is not only about bringing the patient and throwing him in the hospital and leaving. Usually coordination between the pre-hospital people and the hospital. We have a patient trauma and his condition is unstable, and during the primary assessment طبعا في اشياء يسوونها معينه. مثلا البري هوسبيتال بيبل ممكن يعمل له مثلا في بي جي او يسمونها فينس بلاد جازز فيها الهيموجلوبين ليفل، يعني زي البرايمري اسسمنت سريع. he can know that is the patient يعني he suspect that he is having bleeding or not. طبعا once the center or place that the patient is going to is not well prepared or they didn't have the proper or they have a deficiency in the blood bank, they can ask from other hospitals. At the same time you are trying to replace the deficit with IV fluid. طبعا يعني الفكرة ان احنا خلينا نمشي على الايديال سيناريو. النون ايديال سيناريو في لها حلول ثانية. يعني they can transfer to other hospital, they can bring from other hospital. يعني trying to solve it in a way. هذه ما هي بمشكلة المريض، مشكلة المستشفى لازم دم فاتح ER وماسك emergency he should find it. يعني الفكرة انه يا معاذ ما صحوا من النوم الصباح قالوا اوف ما عندنا في arrangement طبي إداري. يعني تفاصيله خاصة دائما في إدارة كل مستشفى، لكن يوجولي ما تصير هذه إلا قليل. ولو صارت there is a replacement. يعني يكون عندهم زي في خصوصا في الحرس في عندهم زي بروتوكول معين ER consultant يعني initiated. فيصير بلاد بانك ينزل له 6 أكياس دم This is for trauma only. Obviously, till they prepare for the patient. لأنه usually البلد جروبينج وكروس ماتشز take 45 minutes، لكن blood grouping ياخذ 20 minutes. فيعني 20 minutes على ما يجي المريض ونحط على البيد وتركب له فلويد والاسسمنت، يعني المفروض خلال 20 minutes blood grouping، لكن اذا صار معها كروس ماتشنج ياخذ 45 minutes. عبد الله تفضل. هنا جاوبتها ترى يا عبد الله. اذا كانت female child bearing age with no exposure before you can give، لكن if you give there is a possibility that the patient will have transfusion reaction. فهمت قصدي؟ يعني انت try as much as إذا كان male you can give، لكن if you have only O positive حط في بالك انه these patients they may have. طبعا O negative is the universal donor، معروفة هذه. لكن once you have O positive especially for the female try avoid it as much as you can، لأنه sometimes most of the patient may develop transfusion reaction. طبعا زي قلت أنا يعني preparing البلد يحتاج إذا كان blood grouping 20 minutes وبلد grouping cross matches 45 minutes. يعني المفروض إن في سنتر محترم المفروض إن البلد should be ready within 40 or 45 minutes، يعني قبل ما البش وصل ونحط له اي بي لاينز واسيست. هذه الفكرة. بس نسينا رشيد. رشيد
هلا دكتور.
what do you think that what are the ways to establish an airway in a patient with upper airway injury؟ أعطني اثنين. رشيد.
سام دكتور ما سمعتك زين.
What are the ways to establish an airway for a patient with upper airway injury? What are the methods to establish an airway in a patient with airway injury?
دكتور maybe chest tube.
قاعد أقول لك upper airway injury وتقول لي chest tube.
دكتور ثايرويد اكتمي، كورتيكو ثايرويد اكتمي.
لا أنت يعني يا تقولها صح يا لا تقولها، لأنه أنا قلتها عدتها أكثر من مرة. كريكو ثايرودوتومي.
يس.
يعطيك العافية. طيب آخر واحد عبد العزيز الذيب. عبد العزيز.
سم.
You have a patient coming. Hey, you have a patient coming with a trauma, and upon examination, you found that his blood pressure is not improving, and this patient is unable to move his upper and lower limb, and his level of consciousness is affected. What is the most important thing to be done at the patient at the moment?
معلش دكتور بس لو تعيد من البداية.
A patient comes with a trauma and his level of consciousness clear. His glaucoma scale is 8 and he is unable to move his upper and lower limbs. What is the most important thing at the moment?
Check if he has any hemorrhage. لأنه ممكن ما يكون في دم واصل للبرين.
هذا اللي كنا نتكلم يا عبد العزيز. ما عنده بليدنج، اموره زينه يا عبد العزيز. دمه ممتاز 15، دمه 20.
أيوه.
طيب
بلد بريشر عنده نازل.
غير عبد العزيز، ركز في السؤال زين. لا سيف، نو ماتيو. دار الحداد، عطنا رايك. يلا.
Yes.
What do you think about this? About the scenario that was given? لعبد العزيز الديب.
دكتور عيد
نعيد السؤال. Patient coming with an injury and he's conscious. His Glasgow coma scale is 8 and he cannot move his upper and lower limb. What is the most important thing at the moment?
He had head injury.
So what we'll do?
Give him fluid.
غير يا عبد الله، غيره. عطني إجابة مقنعة. قاعد يموت وانت قاعد
put say or يعني protect his spine.
غيره protect his spine. طيب غيره. اللي يرسل لك واتساب قل له يمديني الحق ارد قبل سنين.
والله ما ادري يا دكتور الجواب.
لكن الشباب اللي بيساعدون بعض. A B C patient عنده Glasgow scale 8. He cannot control his airway. Patient he's having injury of the upper and lower. He cannot move upper and lower limb. غالبا عنده upper neurological injury. اروح ادور leading ولا اروح ادور fluid. I should control his airway. تأكد he can control his airway or not. I will put orotracheal tube. I will put nasotracheal tube. لكن ما دام اعطيتك رقم قلت لك ان عندك Glasgow coma scale 8 معناه his Glasgow coma scale is low. This patient should be intubated. وبعدين دبر فينا حاجة ثانية. واضح يا شباب؟
طب دكتور مو مفروض اصلا نسوي الايروي قبل نجيب الجلوكوما؟
انا اعطيتك السيناريو. المريض جاب لك البري ميديكال، وصل لك المريض قال لك لسه ده سيناريو. يعني ممتاز يا محمد. سيفير هيد انجري. بيشنت جاك حق الاي ار قال يا دكتور شوف هذا المريض، انا البرايمري اسسمنت حقي هذا. انت بتقول والله معليش انت اعطيتني الجي 6 قبل الاشياء. انت تتعامل مع المريض كامل. لكن انا لما اعمل لك من البيسك اقول لك اي بي سي. عرفت البيسك؟ جاك نفرض مثلا جاك حق الاي ار قال يا دكتور انا هذا المريض من اول ما جاني his DCS is not improving. جيته جاني 10 والحين صار 9 بعدين صار 8. قول والله سوري معليش انا لازم اعرف كل حاجه. You should assess the patient from head to toe. A. Why his level of consciousness is changing. A. level of consciousness affected غالبا due to neurological issue. لكن أنا متأكد إنه while I'm assessing him he's alive. يعني ما أفحص المريض وهو قدامي deteriorating. I'll assess his airway. There is airway intact. خلاص I will go to B. Then I will go to C. Then I will search why he is GCS is low either due to head injury, cervical injury. فهمتني عبد الله؟ أنا أبغاكم شباب عشان السيناريو ينفهم صح وقت الاختبار يتجاوب صح. Very important إن to put in your mind that السيناريو ما راح يجيك واضح. السيناريو you should able how to analyze it. Okay. Clear guys or not? طيب.
كلير يا دكتور. دكتور في صوت ازعاج عندك.
عندي صوت ازعاج انا؟ ما عندي صوت ازعاج. ما لمست الكيبورد ولا جيت. ما طيب. احنا خلصنا الحين السيشن هذا، لكن في جروب مفروض انه وير سبورت. اي فيصلي الجروب اللي بيكون معي موجود في المفروض البيت سايد تيتشنج في الهوسبيتال بنكمل هنا. اللي يبغى يكمل معنا حياه الله، اللي يبغى يروح ويشوف اذا عنده حاجه ثانيه الله يستر عليه. لكن now from our side we finished.
دكتور انا معك في الجروب ايوان، يعني وش ناخذ بالضبط؟
بنتفاهم خلينا بس قبل بنتفاهم بحاجه. لكن في اي سؤال للتروما؟ ما في سؤال. طيب ممتاز معك ممتاز. طيب اللي يبغى تفضل عبد الكريم تفضل.
بس دكتور بعد اذنك سؤال بالنسبه للبريجننت وومنز لما يجون في الاي از يعني تروما كذا اللي هو نتعامل وي ار تو لايفز. اوكي
هذا سؤال
بالنسبه للبيبي ايش الاجراءات اللي تتبعها او
الفكره؟ شكرا لك. طبعا السؤال هذا اول شيء there are physiological changes that relate to the pregnancy will affect you. ايش معناه؟ يعني البيشنت اللي pregnant usually في عندك اشياء تغير الفسيولوجي about the normal person. اولا زي ما قلت انت you are dealing with two persons اوكي مشكله، لكن انا قصدي first these patients usually according to the which trimester first second third trimester. هذا السؤال الأول. السؤال الثاني if it's in the first trimester في بالك انه usually these patient physiological changes they are near or يعني near normal لانه تو البيشنت didn't start to have the يعني full pregnancy which will affect the physiology. يعني ما في big راس، البلاسنتا لسه small، فيعني they are near normal. لكن when you are doing the primary assessment most important thing that you should put in your mind in the first trimester that it is the life of the baby and the risk of abortion is high. المشكلة ان the risk of the abortion is high and the related bleeding with it is high. فتحط في بالك انه these patients usually once they're having a trauma, risk of abortion, the obstetric and gynae should be involved. Documentation by ultrasound, it should be done to assess the viability of the baby. Explain for the patient that there's a high possibility according to the mode of the trauma that she will abort. غالبا هذا اللي يصير في الفيرست trimester. Second والثird trimester size of the uterus is becoming big, so the patient usually اللي يسمونها الهايدريشن you should give them large amount of IV fluid. Usually due to the pregnancy, uterus is big, so any injury to the anterior part of the abdominal cavity, there is a risk that the ureter will rupture. طبعا اللي بيقرا كتاب الاي تي ال اس متكلمين عن حاجه يسمونها اللي هو emergency cesarean. ففي indications معينه للemergency cesarean، مثلا transfusion of large amount of blood، اشياء معينه للviability of the baby. لكن حط في بالك انه these patients they may go for emergency cesarean section. Documentation of the viability of the baby. Physiological changes related to the hemoglobin itself. يعني patients maybe she will be anemic in the beginning once she come. She's already known case of anemia اللي سيدها مع pregnancy, so you will be in doubt, is she anemic due to the low hemoglobin level or due to her pregnancy status. طبعا these patients usually they have some sort of coagulopathy, a risk of the clots, a risk of the DVT, a risk of any coagulopathy in these patients. Another thing, what type of antibiotic that will be related or what type of antibiotic that should be proper for these patients. These patients, there should be a continuous monitoring of the baby and the pregnancy, because at any time the patient may go for an emergency cesarean. يعني ممكن تجيك stable في البداية، لكن بعد several hours her pregnancy or her vital will deteriorate. هذه مشكلة البريجنانسي، انه it is a multi trauma او multi team task، والتيم ليدر فيه او الموست important one is the الجايني اللي هو obstetric، لانه viability of the baby will affect the viability of the mother by itself. في اخر كتاب الاي تي ال اس بيتكلم عن البيدياتريك، بيتكلم عن الجاين، عن البريجننت، وبيتكلم عن الجيرياتريك اللي هو الاولد بيبل. افتحها عبد الكريم، فيها كلام ترى كويس، يعني في كلام كثير. طيب انا خلاص خلصت، اللي يبغى يحضر، اللي يبغى يروح يكمل. هنا كذا بريك 5 دقائق فيصل ونرجع لساعة 10.
تمام، يعطيك العافية دكتور.